Hello, this is Nicole Raleigh, pharmaphorum web editor, and I am on site at ESMO 2024 in Barcelona. And I have with me today Sven Schaffer, who is Senior Director of Medical Affairs Europe at Illumina. Welcome, Sven.
Thank you.
So we're going to be discussing how a simple blood draw can transform clinical practice in oncology. So quite a topic to be discussing. To begin with, though, Sven, please could you share what your journey has been like to this point, doing what you do with Illumina and the passion that drove you there?
Yeah, thank you for this question, so Nicole. Yeah, so I've been in the diagnostic industry for more than 20 years, and here at Illumina, as the head of Medical Affairs Europe, I'm really driving the adoption of comprehensive genomic profiling and liquid biopsy into clinical practice together with the oncologists and the pathologists across Europe, together with my team and Illumina. And this is really exciting, bringing this technology and precision medicine close to the patient.
Absolutely exciting is the word, I feel. So if we turn now to molecular profiling of tumours, it's crucial for optimizing cancer treatment in clinical practice. This is very much clear. And one innovative method, analyzing circulating tumour DNA or ctDNA from blood samples, is on the cusp of becoming a standard approach in managing patients with advanced cancer. So I was just wondering if you could tell us more both about molecular profiling of tumours in general and also a bit more about the ctDNA method.
Yeah, so first of all, we at Illumina, we are very excited about the developments in cancer diagnostics with regard to comprehensive genomic profiling and then liquid biopsy as an innovative way to access and examine a tumor DNA, which clearly shows benefits for the patients along the continuum of cancer care. And this is something we want to highlight here at ESMO, also with our symposium. So comprehensive genomic profiling has the potential to provide all actionable mutations and all the information about DNA aberration in one go with a very short turnaround time. So the benefits of the patients to increase the number of patients receiving targeted therapies, but also to shorten the time the treatment of these patients can be initiated, which is of the benefits for the patients, obviously, in terms of the efficiency of the therapies.
So acceleration is certainly sort of a theme that's come with this development.
Yeah. Yes. And when you think about liquid biopsy, the benefit of liquid biopsy, we will discuss here further at ESMO, is with, against the background that it is minimally invasive. It offers easy access to the tumor DNA, and the sample collection is highly reproducible and can be easily standardized. And when you think about the heterogeneity and the clonality of the tumor, liquid biopsy offers has a potential to offer a complete picture of all actionable mutations for the patients, with all the benefits in terms of finding the right therapy, the best therapy for the patient.
Exactly. So this is going towards precision medicine or precision oncology, providing, as you say, this comprehensive, non-invasive and specifically rapid method to identify clinically relevant biomarkers. So I was just wondering if you could comment more generally on this precision oncology space, which is something being explored widely at the conference this year, and how that has been transforming both in the field and as a transformative focus for Illumina itself.
Yeah, I think we have what we see here at ESMO and elsewhere is fantastic clinical evidence demonstrating the clinical utility of precision oncology and also of comprehensive genomic profiling, and as said, liquid biopsy. So we have fantastic data and we have also fantastic biomarkers that is in the long list of biomarkers constantly increasing. What's missing and what is limiting precision oncology today is the access. It's the access to innovative treatments in many countries, and also to the access to the corresponding diagnostic tools. And this is something Illumina is keen, to develop together with the pathologists and oncologists and the stakeholders in the different countries to make these technology accessible. So the field is rapidly evolving with new exciting developments, but at the same time, we have to make sure that the patient have access to the innovation that is available today already. And this is clearly a bottleneck for precision medicine today.
Okay, so access, diagnostics, the whole patient. So going back again to what Illumina is doing and its external collaborations and internal experts, what have you been sharing at this Congress, ESMO 2024? Can you speak to that a little?
Yeah, so Illumina is collaborating with countries on the implementation of precision medicine and comprehensive genomic profiling. And we are trying to help the healthcare providers in understanding the use cases for precision medicine and comprehensive genomic profiling in clinical practice. And this is what this symposium at ESMO, our symposium, is about and what we want to highlight. So we have one example and one study where investigators from Wales investigate the clinical utility of having a comprehensive genomic profile available at the time of diagnosis. So it is the early access of this information and what this clinical utility will bring to patients in lung cancer, which is very exciting. And the other example is the complementary approach. So what is the added value of liquid biopsy in comparison to tissue biopsy? So the investigators from Norway compare tissue comprehensive genomic profiling and liquid comprehensive genomic profiling side by side to really better understand what are the benefits of liquid and what are also the limitations of liquid biopsy, really to understand also based on the cancer entity, what are the best use cases for the patients and for the technology, depending on the clinical indication.
Fascinated and needed stuff. Thank you for sharing that. So lastly, what's the future hope for these innovations in oncology? Have perspectives shifted at all between sort of pre-ESMO and towards post-ESMO as I speak to you now?
Yeah, I think what we see here at ESMO is exciting and really compelling data, again, demonstrating the value of precision medicine. For Illumina, it is a continuum, and the world is not changing after ESMO. We are working on giving patients access to precision medicine. This is something we have done before ESMO. We will continue after ESMO, and as we see this as the biggest bottleneck for precision medicine today. On the other hand, the field is rapidly evolving, right? So what we see here at ESMO, driven by the pharma companies, is of course advancing the personal and precision medicine and personal targeted treatment. On the other hand, of course, other drivers are big data-driven multi-omics approaches, but also artificial intelligence, machine learning, something, of course, Illumina is also focusing on to further advance precision medicine in the future.
Exciting indeed. Thank you very much for your time. It's been a pleasure, Sven.
Thank you.